Hi, good morning, good afternoon. We will start in just another minute. We'll give folks a chance to join. Welcome. Thank you for joining us today for the Society for Health Communication webinar. All right, I have one after, and I have a little bit of housekeeping before I introduce our wonderful speakers. So I'm going to go ahead and start with that, knowing that folks are continuing to join. Thank you again for joining the webinar today. I am Erin Norvell. I am very proud to serve as the 2026 president for the Society, along with LaShondra Cordier, who you will meet towards the end of the webinar, who's the current vice president and will be coming on as president next year. Thank you so much for joining. If you don't know much about the Society, you have the opportunity to learn a little bit more today. And welcome. So I will start by giving some background. The Society was founded in 2016, which means we are celebrating 10 years strong today, which is amazing. We bring together health communication professionals and scholars really across different industries and disciplines. That is key. And that is our mission that we are committed to. We know that health communication professionals work in a lot of different places. They work in large organizations or small organizations. They may work with a team with a lot of money, or they may be the only one in their organization. And we want to provide a place for people to come together, to learn, to make connections, and to unite in support of health communication. This is our 2026 executive leadership team, and I could not be more proud to serve among these wonderful women. So the housekeeping for the webinar, all attendees are automatically muted. We are recording the session and it will be available later in the coming weeks. The chat is open and we welcome you to use it for discussion and connection. Please submit your questions through the Q&A function, and we have a way to filter those and help answer them throughout and at the end with the speakers. You can message the host if you have any technical issues, and you're welcome to turn on closed captioning should you need it and you have not already done so. So I am really honored to welcome our speakers today. We have two fantastic speakers, and they're going to help us learn deeper about all things AI. So I'm going to start with Amelia Burke Garcia, who I will say was one of the founding members of the Society 10 years ago. And so we're so pleased to have her here today, still in support of the organization. She currently leads NORC's Center for Communication Science and the Digital Strategy Outreach Program area. In those roles, she designs and implements strategies that leverage the science of communication to influence behavior, which is such a core tenet of health communication. She has worked with influencers and done research around them for more than a decade, and now her portfolio has extensive work in the AI space as well. She's authored two books, which I highly recommend. Influencing Health, a comprehensive guide to working with social media influencers, and Communicating Through a Pandemic, a chronicle of experiences, lessons learned, and a vision for the future. We also have Brenda Foster, who I'm really excited to have here today. She is the Senior Vice President and Chief Innovation Officer at Vanguard Communications, which is a DC-based firm focusing on social issues and behavior change. She is known for helping organizations move from awareness to action. Her campaign leadership efforts include shifting the national conversation about family farm food and increasing understanding and acceptance of mental health issues. As Chief of Innovation, Brenda works on responsible innovation with an emphasis on artificial intelligence application in communications. What does that mean? How can organizations can use AI to improve insight generation, productivity, while also protecting accuracy, brand voice, confidentiality, and of course, public trust, which we are talking about often these days in health communication. Brenda also teaches as an adjunct professional lecturer at American University's School of Communication. Thank you both so much for joining us today, and I'm very pleased to hand it over to Amelia to kick us off.
Okay, great. Thanks, Erin. And thank you, Society, for having us here today. Um, I think that this is one of our, hold on, one of mine, and I would hopefully it's okay to speak for Brenda because we've talked about this before, one of our favorite topics. I am just trying to share my screen here. Here we go. And could I maybe just get like a icon thumbs up if this is showing up for folks on their screens, Erin or Lashandra?
It is working.
Yes.
Okay, thanks, Dana. Okay, great. So Brenda and I are gonna sort of tag team on this presentation. I'm gonna talk a little bit about the research. Brenda's gonna talk about sort of uh, translational work, real applications. I'm gonna hit on a couple of those points, but I'll talk through them very at a high level because Brenda is gonna do a great job and she's done this before and I've seen her speak and it's amazing. Um, but I wanted to sort of just set the foundation for this topic. And I want to first disclose that I actually made this presentation with Claude. I actually created the slides, so I did the slides myself, but then Claude helped me make this a little snazzier. So you can see that in like the lower left-hand corner there of the slide. So why does AI matter for us? So I don't think that any of us in this on this Zoom today are uh, um, you know, are unaware of this or not feeling this directly, but public health is under pressure. It has always been sort of not well funded. However, I think right now we are experiencing a lot of extra pressures in terms of funding cuts, challenges to science and evidence and differing perspectives on um, you know what kinds of health practices are uh, important for people's health and well-being. Um, and I think that this is all converging at a moment when AI is sort of upon us, right? At least in its current format. And I think it is important for us to be thinking about AI as a tool in our toolbox, something very important that can really help us move the needle, right? So um, and we can talk about this, the trajectory that AI is on, and where we may see real substantial shifts in our work environment um, because of AI. But at in today's moment, like where we're talking today on this webinar, AI is a tool, and it is a tool that requires human oversight, but it can really help us in terms of reducing the burden of repetitive tasks, improving message clarity, helping us do more with less, and thereby helping and hopefully, freeing up time so that we can sort of do the hard work that we're faced with right now, which is really how to reach people with the right message at the right time and rebuild trust. Um, and so, again, I think we can have a broader sort of existential conversation around AI and what will happen in our to our workforce and across multiple different types of workforces. However, as we're thinking about it today, it really is an assistant and it doesn't replace your expertise. But let's first start with a definition. What is artificial intelligence? So there's a lot of ways to define it. This is how I talk about it, but you could go and find sort of slightly different uh, definitions out there. I refer to it as a simulation of human intelligence in machines that are programmed to think and learn. And so essentially, it learns from data um, rather than following explicit rules. So that's what makes it different from prior technologies, right? It's not being programmed to do something. It actually is being trained on a corpus of data and then it learns to recognize patterns because of that training. And then because of that, it can extrapolate from sets of data that it's never seen before. And so when we think about types of AI, again, there's lots of different ways to organize the types of AI. But just as like one framework for you to think about, there's what's called narrow AI. This is where we're at today, right? So these are task tools that are supported by AI technology. Powerful pattern matchers really require human-defined objectives and oversight. Then there's artificial general intelligence, which probably is a term familiar to some of you. This is really kind of human level reasoning across all domains. Some of the AI companies are saying that they are approaching achieving AGI. And certainly we're seeing really, high levels of operation and sort of thinking coming from some of these advanced technologies. Um, some of the newer models of Gen AI are being created by AI, right? So like that level of sophistication is kind of moving us closer here. But technically, AGI is still theoretical as far as that we know. I mean, again, everything is changing day by day. And of course, you all probably saw the news about the release, but really holdback of the Mythos AI from Anthropic, and the understanding there is that it is extremely powerful, too powerful to release. So, and then there's super intelligent AI, which is beyond human intelligence, and as of this moment is still theoretical, highly hypothetical. So I think I kind of touched on this, but essentially this is how AI works. Again, I'm not a computer scientist or an engineer, but I know enough to sort of understand the processes by which this works. So you collect your raw inputs, you train your algorithm. That algorithm then can recognize patterns, and then make decisions based on those learned patterns. And here are just a couple of techniques in terms of how AI operates, right? So machine learning, right? So that's the algorithmic part of this, right? That helps computers learn from data and improve over time. Natural language processing is the ability to interpret and understand language. Computer vision is the ability to interpret images. And robotics is essentially what you would think, right? It's robots. It's the ability for mechanical systems to just sort of operate in the physical world. So applications and potential applications, AI is not new, right? So I think the current form of it is newer. It's sort of just maybe in the last 18 months to 24 months kind of in our consciousnesses in the way that it is right now. But we've all been engaging with AI for a long time now, right? So virtual assistants like Siri, Alexa, Google Assistant, recommendation systems like we experience on Netflix and Amazon, smart home devices like thermostats, cameras, appliances, and then of course healthcare diagnostic tools that do help with image analysis, symptom checkers, and then fraud detection. So like when you get your pings around a credit card charge, or if something's going on in terms of your bank, like those real-time pattern analyses that are done are often using AI to do that. And then, of course, AI in health and medicine has been used for a while in different capacities, and I think more and more it's increasingly being used, which I think Brenda will talk a little bit more about. But things like personalized treatment plans, medical image analyses to detect tumors. I spoke at the World Tuberculosis Day event in New York City a couple weeks ago, and a year ago, I gave a similar sort of AI presentation at a tuberculosis event in Atlanta and for the CDC. And in preparing for both of those events, right, one that was a couple weeks ago and one that was over a year ago, there was a lot of work using AI in the tuberculosis space to do tumor analysis, right? So it has been around in use in different contexts for quite a bit of time. Predictive analysis for patient outcomes, perhaps newer, but something that is actually quite can be a real powerful driver of identifying health issues or potentially negative health outcomes, and then being able to target messaging or interventions more effectively. and virtual health assistants, right? So triaging symptoms, answering questions, things that I think we may have all been using, and those tools are getting better and better and better. And then, of course, there's social listening from a communications and education standpoint, which I think everyone is familiar with. The ability to use AI to translate and simplify complex medical content. If you've used AI to help you with an email or help you turn a longer form piece of content into a social media post, you've experienced this. Personalized education, so really being able to target messaging by different subgroups and do that rapidly and at scale. And then Q&As and chatbots for question and answer and like health information. So what does some of the early research tell us? This is kind of the core, I think, of what I wanted to share with you today. So there's been a lot of work. Some of this is in preprint, some of it is from academic sources, and some of it is from the tech companies themselves. But I think that there's a lot of just different interesting points that kind of come together to support, in fact, how powerful AI is really in the health communication context. So some early research, and this was first done in 2023, and then it was again replicated in 2024 with similar results, essentially found that patients, when engaging with a human health communicator compared to an AI health communicator about different health topics and sort of the delivery of different types of health messages, found that humans preferred the AI responses to the human responses. And in other research, they found that when testing a human health communicator against an AI health communicator, the AI actually performed on par or better than the human on the LEAS scale, which is the level of emotional awareness scale. So again, in terms of benchmarking on different measures and then also patient preference, we're seeing AI perform as good or better than humans. In other research, and this is Penda Health and OpenAI in 2025, found that, again, this is that human in the loop, right? So clinician paired with an AI. There was a 16% reduction in diagnostic errors when a clinician used an AI versus when it did not. So it's clinician alone compared to clinician plus AI, and finding a 16% reduction in diagnostic errors and a 13% reduction in treatment errors. Other research from Google, they were testing their new AI model, found that on measures of empathy, accuracy, the AI model outperformed primary care physicians, and again, either performing on par or outperforming the primary care physician. And then this study was, a version of this study was done in 2025 by Vetter et al., and they found similar results. So again, you're seeing that some of the early stuff that came out as either preprint or from some of the tech companies is being done now by more academic authors and principal investigators, and finding similar results. So we're seeing how these AIs are really stacking up against human health communicators in multiple different contexts. I'll also just note that the Journal of Health Communication now has a dedicated section to AI, health, and digital spaces. I've been the editor of that section over the course of 2025 and part of this year. We released our first set of articles at the end of 2025, or it may have actually come out in January. But this is going to be an emerging space for AI and health communication related data and research and innovation. And so keep an eye on this section as it moves forward. And then I just want to note, we're hearing all of these things, right? This research and how AI is stacking up against more traditional health communicators. But will people really use AI for health information seeking? So as we think about our own work as health communicators, and this is data out of NORC from the end of 2025. We ran these questions on our AmeriSpeak Omnibus panel, which is our national adult probability panel. And we released them in November. And we found that 27% of adults have used AI for health information seeking, and another 24% plan to start using AI for health information seeking. This is trending with some newer data. I've recently seen some things from Kaiser Family Foundation and a couple of other sources, and they're tracking around like 33%. So these came out at the end of 2025. We're now in sort of, Q2 2026. And we're seeing, slight increases or equivalent data. So, people are using AI for health information seeking, and it's notable because of how AI is still relatively new as a technology for us in its current format. I'll also note in our study we found that about 50% of respondents reported that they trust AI as much or more than traditional or social media, meaning like AI's overtaken those channels as trusted sources. And notable, while the number is small, I think it's something really important to track. We saw that 6% of respondents reported trusting AI more than their own personal healthcare provider. And what's notable is 15% said that they trusted AI as much as their own personal healthcare provider. Again, thinking about the trajectory of the growth of Gen AI and chatbots like ChatGPT or Claude or Google Gemini, it's pretty amazing to see some of these numbers, even if they're lower end of the bound in terms of like from a statistical standpoint. Definitely something to track as we use it more and more. And then I just wanted to share a little bit about what we're doing over at NORC in this space. So we launched in 2023 an initiative called Health Communication AI. Really trying to examine the intersection of AI and health in today's communications environment. We're working with a lot of different types of clients to really understand how AI is impacting health and well-being. And one of my priorities is doing some benchmarking work in this space. Like, what does it mean to be like, what does it mean to be empathetic? Like, what is a benchmark for empathy in an AI-driven environment? What does it mean to be accurate, right? Humans are not always accurate. So what does it mean for an AI to be accurate? Are we expecting 100% accuracy all the time or not? So we're exploring a lot of these different topics and methodological types of work as part of this initiative. And then we've also built a research tool called Thea, our trusted health information assistant that can be used in research to test AI-delivered messaging against more traditional messaging, and how does that impact people's knowledge, attitudes, beliefs about different health topics, trust in that information. How does AI layer on top of sources and strengthen or weaken or nothing else, the trust of that information. So I have in this deck, which you all will receive, some use cases and tools. I'm going to actually skip through this section because Brenda is actually going to do a much better job of talking about this than I will. But I do want to just land on a final point before I turn it over to her, which is this one, AEO and GEO, which it says the next frontier. I'm not actually so sure that it's really a frontier. It's kind of a frontier that's upon us, right? We need to be thinking about this right now. So if you're not familiar with the terms AEO or GEO, it really refers to answer engine optimization or generative engine optimization. And those refer to the ability for you as a public health communicator to get information from your organization, from your report, into AI chatbots, essentially, right? These like Claude or ChatGPT or others, that will be scraping the web for information in order to answer people's questions and making sure that your information shows up. So given that we know from our NORC data and other data that AI is in fact a place that people are turning to for health information, if we're not building our information to be optimized for AI retrieval, there are going to be gaps. Those gaps will be filled with other types of content that could be lower quality, inaccurate, or just, irrelevant. And so one of the things is for us to be thinking about our website content, any reports we put out. What it means is really making sure that we're using short, concise bits of information and bulleted information. AIs love bullets. So when you're thinking about developing reports or website content, making sure you're keeping this in mind. Even there are people who are now developing lengthy reports, policy briefs and whatnot, and they're doing a set of bullets at the top, which are like the bullets that the AI will actually retrieve. So learning more in this space, spending some time here as we're seeing SEO and a website drop off because of AI summaries and because of AI tools being places where people are going to and not going to the website, really thinking about how do you make your information show up there is key for us right now. So looking towards the future, AI is going to continue to evolve. What we're talking about today, in 3 or 6 months, it's going to shift again. It's going to continue to shape industries and daily life. Understanding these fundamentals, I think, is key for us as a field to really engage with it responsibly, but also to really help us do our jobs better so that we can serve people better. So you can read more about this work. Here are some of the references, and I'll be happy to have a discussion at the very end. And with that, I'm going to stop sharing and turn it over to Brenda.
Thanks, Amelia. I really appreciate all of that. And that was such good information leading up to what I'm going to talk about. And I do also recognize that this is a very short time to try to get a lot of information out. And it will not, this is literally just going to wet your whistle when it comes to AI and how it can be used in health. So I want to just acknowledge that to start. But where I want to go with my presentation is to talk about how this helps the people that most of us got into public health to help in the first place. So first of all, it's important to know that most healthcare organizations, from very small community organizations all the way up to the biggest, pharma health groups, 85% of them report using AI or at least exploring generative AI. So there are a lot of people out there doing a lot of things. I can't tell you that all of them are effective, but that they're experimenting is a really, really good, a good piece of information. So let's start with why I'm so excited about AI. I'm excited because, to me, the best use of AI in health communication is addressing the needs of underserved populations. Unlike other technologies, let's think about, I've been around for a lot of technology changes. So the internet, the web, social, a lot of those things really just skipped right past the people who maybe could have benefited from them the most. AI is a different kind of technology in that it can actually be deployed to help people who are most vulnerable. And if we use this correctly, it can actually close that digital divide that those populations have been experiencing, and it can also give them more access to health than they've maybe ever had before, or that we could afford, to be honest, afford to give them. So there's all kinds of things that we know it can be helpful with. Financial and insurance barriers, geographic and transportation, workforce shortage and availability issues, especially in rural communities, language and culture barriers, which we know are huge in public health, mistrust, another huge one, inequity and discrimination, socioeconomic determinants of health, tech access, delayed or low quality care, and just generally underrepresentation in research. I'm going to go through a few of these just to give you an idea of how we believe there's a lot of promise for this. So first, financial and insurance. It doesn't, right away, it doesn't sort of compute how this might help. However, AI is able to explain insurance and reduce administrative costs to improve price transparency for people, for payers, right? So I get to know ahead of time why something's going to cost the way it's going to cost. That complicated insurance information that I maybe don't understand, or I mean, let's talk about Medicare and Medicaid and how difficult that is for people to understand. Even those of us who sort of work in those arenas, this can help you explain it better to your patients so that they can get better care. A lot of the examples I'm going to give you about what's being used right now are from larger organizations because they're the ones who can afford to invest in this the most. But at the end, I'm also going to show you ways that people in very small organizations can put this to work to do some of the things that you did not have the funds or the resources to do before. So next, geographic and transportation barriers. We already know about telehealth, and that's awesome. But there are a lot of other ways that AI can be deployed. Symptom checkers like Ada Health guide users through care decisions remotely. And what's interesting about these things, and also this was very interesting, WHO and CDC, even back during the COVID days, actually deployed AI chatbots in WhatsApp, which is such a universal app for so many communities, to reach people around the world with important messaging. So what we know is that from research, as Amelia said earlier, people actually trust this information a lot. And in many cases, it's actually getting the explanations more accurate and diagnosing more accurately than the 10 minutes that sometimes health providers can spend with their patients. Health literacy and information access. Now, we all know that there's a lot of misinformation out there, so it's really scary to think about how much misinformation is getting by, especially for our most vulnerable patients. But it does translate medical jargon into plain language, and it can provide Q&A so people can say, my doctor told me this. What does this actually mean? This is really important, especially if you are in a culture where maybe you're not respected. You can even be, I know as a woman, sometimes I have a hard time communicating with physicians the way that someone else might communicate to them. So allowing AI to fill in those gaps at least gives us something to work with. Language and communication barriers. This one for me is so exciting because we've been working in multilingual communication for many, many years at Vanguard. And the time that it takes to do, the time and resources that it takes to translate just one language, it's really exciting to think that there's a tool out there that can shortcut it a bit. Now, does that mean that it's all going to be accurate? Absolutely not. It still needs that extra context from native speakers. But even getting to the place where native speakers are reviewing various dialects of Spanish takes so much longer without these tools. So being able to, and also we're never able to translate into the number of languages that we need, usually with the resources that we have. This is allowing us to do that, offering multilingual chat, text-based support where people can go to Google Translator and translate things on their own. All of those things are things that are going to help people that we really want to help in a way that we just haven't had the resources to do. And it does not want to go forward. We are stuck. There we go. Oh, now it went way forward. Woohoo! Okay. So I want to talk a little bit about the opportunities for AI to help us improve our work on a daily basis that really don't involve expensive tools. So let's start with audience research and segmentation. true public health practitioners understand how incredibly important it is to get these right. There are data sets out there that you have access to, but think about how long it takes you to take this data set about your audience, this data set about their habits, and all these other things, and try to put them together to figure out, what does your audience actually think? We often turn to focus groups of 15 or 20 people for inputs. There's nothing wrong with that, but it isn't exactly a large picture of the audience. AI can take those data sets that exist, they can take your survey responses, they can take social media commentary in a variety of ways, and uncover patterns that it would take us so much longer to uncover between behaviors. What are people actually doing? How are they actually going to their vaccines, and why aren't they, right? Why aren't they doing the screenings that we've asked them to do? What are their attitudes? And then what are the barriers? Look, we talk about barriers and benefits throughout public health. The idea that we can figure this out through all of the different research lenses that we haven't had access to before is really exciting, because many times when we ask those questions, people give us the answers we want to hear, not what's actually going on. By doing this, we can get a real sense of how things can work. So when you look at how a use case for this, for example, so let's think about it. If we were trying to increase colorectal cancer screening rates among adults 45 to 60, let's talk about the data inputs we could use. So there's CDC data sets out there, plus insurance claims data, survey responses about screening attitudes, social media conversations about colonoscopies, right? Put all of that together, and then those natural language processors, NLPs, if you see that, they will cluster responses. So they'll take a look at, I don't feel like I'm at risk for colorectal cancer. I have no idea how much it's going to cost. Is it covered by my insurance? And then it can take those and it can put them into segments. So let's assume that the segments for this might be avoidant but aware, right? So they know people who are misinformed about the procedure, people who either for cost or for geography can't get there. They know everything and they're still procrastinating. But suddenly you have 4 segments you might not have been able to identify within your target audience, because AI has been able to do way deeper research than you ever had access to. So in the end, you get 4 tailored audience strategies grounded in real data patterns. All right, so let's look at message and content creation. Plain language health content. Again, it's not that we didn't know how to do it, but think about how long it takes us to get there. AI can help shortcut that so that you're doing more culturally tailored messaging. You're able to provide those materials in multiple languages. And here's the best part. When you finally get all of that messaging straight and you know exactly what you want to say, you usually put it into your first format. Is it a fact sheet? Is it a press release? Whatever it is. But to be able to take that format that you feel really confident in, give it to AI and say, now give me a text-based messaging campaign, social, and emails, right? That means you're able to produce so much more content than you were before. And this is not content you might have ever been able to produce because you just didn't have the resources. AI sort of becomes your assistant. And I want to be clear, your assistant, not the author. It can help you with reading level. I know we have Word to help us with that, but thinking about how to keep bringing things back in Word so that you finally got it to the reading level that you want, whereas AI can take, say, a journal article where you really want to share the research with your constituents, but the reading level is way too high. AI can help you bring that down, again, in a way that you may not have been able to do before. And finally, this is really exciting as a graduate teacher, being able to really check against behavioral science frameworks. That is not something that we've been able to do in the past. To be able to say, I really want to make sure that this strategy meets these frameworks. AI can take those and really get you down to the very smallest piece of what you're trying to do. All right, so let's quickly go through this one. So you want to promote flu vaccination among Spanish-speaking parents. So you input, your prompt will have I want to talk to Spanish-speaking parents, low to moderate health literacy. We already know that they're concerned about vaccine safety for kids. We know that they want to be reassuring and family focused. And we know that their biggest channels that they use are texting and Facebook. So that's where we want the messaging. So AI will generate those variants for you and give you something to work with that is based on a lot of other research that it's pulling. The other thing that I have found with prompting is to make sure that you say, I want you to give me links to the research. That is so much easier than trying to figure out what they use to get you there. It can adjust that reading level to the level that you need, and it can flag potentially confusing medical terms. Okay. Sorry, I'm breezing through this. I want to make sure I'm able to hit everything. So AI also helps design smarter campaigns overall. So it can take a look at which messaging will perform best. You know, one of the things that we've been doing for years in public health is sort of that I don't know how many people do it, but we do Facebook A/B testing all the time, right? With different ads and messages and things like that. But what's helpful with AI is that you can run a lot more and get the information back faster. It can help you optimize your channel mix. You can tell it, I have a $10,000 budget for this community. Tell me the best way to use it. And it can help you figure that out without having to do so much research on advertising and partnerships and that kind of thing. It can also simulate the audience response before launch, because it can go through all of the inputs that you've already put in on these other steps and figure out, yeah, this could work, but I think they're going to have a problem with this part. And then finally, it can create those timelines, which again are very, very difficult to sort of sit down and do. That's something I'm perfectly happy to have AI do for me, figuring out timelines. All right, so let's look at a use case scenario here. We want to increase hypertension screening among 40 plus adults in underserved communities. So we have all of these planning inputs, things that I've already talked about in some of the other cases. You past campaign performance, operational data, right? So in other words, like if you're working with a community clinic, what's that capacity and appointment availability? You don't want to be planning a campaign where you shove everybody to come in April when that also happens to be a particular vaccine season or some other activity that's going on at the clinic. Then it will build the campaign plan for you with all of the things that I just outlined. It can forecast the performance and tell you where there are trade-offs that you need to make before launch. And then finally, because you are seeing it happen, you can say, you know what, that didn't work. Our clinic was too crowded. Or we got screenings, but only among this particular part of the population. Why are we missing? And then it can update that timing and delivery, that timeline. Again, I'm not a big fan of doing myself, based on actually what's happening in the community. Okay, measurement and evaluation. What's really nice about this is that you can tell it what you're trying to do. You know, we know that there's so many different areas of measurement and evaluation, but this can give you sentiment, which we don't often get without a lot of really good deep research. It can track appointments and screenings to say, look, are people actually acting, right? Like, are we, beyond those process outcomes, what's actually happening? And they can also detect early warning signals, like, are you getting backlash or confusion? So, for example, what you might want to do is put in social media content, comments, website analytics, maybe a hotline, and then it can tell you whether or not you're getting what you need, right? Oh no, on the sentiment analysis, we found out that people are confused about how to even get help. Is there somebody on the line in my language when I call the hotline? And then it allows you to change what you're doing and go back and make it better so that you haven't run an entire full campaign using tactics that aren't working as effectively. Okay, some other opportunities we have. We have personalization at scale. AI really enables that individual level tailoring. You can look at people's risk profiles. AI can also detect gaps in engagement and highlight disparities in outcomes. It can also identify emerging myths quick early. So some of the information out there, let's be honest, it has been generated by AI. So I'm not going to tell you this is the be all and end all tool, right? Because it's got problems. But it can also be used for good as a tool for good to help you figure out, oh, wow, there are a lot of myths out there, and it can generate that counter messaging based on all of the other audience information that you've given it. Okay. So I do want to talk a little bit about ethics, and what's not on here is something that I've become more involved in as we've started really digging into AI and how it can help underserved populations, and that is data centers. So I want to talk about one of the things that we've been looking into is how we can help underserved populations understand, or any population, frankly, understand zoning laws. So data centers, yes, AI has made them more ubiquitous, but they were already quite big and large just based on things like streaming. Our Netflix is part of the data center world. Amazon, all the work that Amazon is doing in these areas, data centers are just, they're needed, right? But they are not, I don't like where they are. I'm in Northern Virginia. I don't like where they've ended up here. I don't like how they're targeting and how they're being unfair. But one of the areas where I feel like we have to think about what is our job as health communicators is to help people understand how zoning decisions are made and get them interested in actually showing up to those meetings. So that's one of the ethical considerations I wanted to address. We also have to worry about privacy and HIPAA compliance, bias. A lot of platforms have baked in bias. So one of the things you want to do before you really start using a platform is ask questions. Take a look at what their statements are on their website to make sure that they have at least tried to work on bias. There are a lot of places out there. There's something called Change Agent that has worked on that bias. And there are other organizations that are working on AI tools that really try to reduce that bias up front. Finally, governance and accountability. I do want to make sure if you are going to use AI, please don't do it without knowing what your policy is. And we do a lot to help people with put together their policies. We have a lot of information about that on our website. But without those policies, people don't understand a lot of the areas where they're the most vulnerable. Okay. So these are some of the do's and don'ts. And I think most of these on the do's, you understand HIPAA compliance. What I do want to make sure is that you also understand that what tools are compliant and what aren't. And that's another investigation that you need to make when you start to use AI for any kind of health communication. And then finally, here are some basic tools. These are not what, pharma is using. These are not what giant hospitals are using, but they are what you can use to do some of this work. And in fact, sometimes you can actually get some of these AI tools to build a bot for you, to build an app for you that will do what you want, or at least it doesn't build it for you. It tells you how to build it step by step. So I'm sorry I had to go so quickly, but again, same as Amelia, I'm available for questions.
All right. Thank you. As we get the other slides pulled back up, I just want to say hi, everybody, and hopefully you can see me. For those of you who haven't met me yet, Erin mentioned I'm LaShondra Cordier. I'm your 2026 Vice President for the Society. I also serve as the Vice President of Growth and Impact at HCN Global, where we focus on multicultural community engagement and health equity. So the conversation today was very, very important to the work we do. So I'm so glad to have been able to hear the speakers speak. I'm going to start off by saying thank you to Amelia and Brenda. This was incredibly informative, and I think the chat would agree. We've got quite a few questions for you guys, so we're going to do our best to get to all of them. As a reminder for folks, please use the Q&A button at the bottom of your screen to put your questions in the queue, and we'll do our best to get to everybody's questions today. So with that, I have a couple, I'll field some for both of you, and I'll start with one of those questions, and I have some individual ones for you. So a question for both of you that came through the chat. Someone said, as a public health professional who heavily works within an equity frame, how do you balance, or how do we balance the use of AI as a good tool and the heavy environmental racism that requires it to operate? So it's a multi-part set up. So that's the first question. How do we find that balance? And then they also asked about AI data centers being built in poor neighborhoods and the use of water and electricity to do that. So from an equity lens within public health, do you want to comment on the moral conundrum that we might not be able to ignore in that space?
Brenda, you sort of acknowledged you're doing some of that work. Why don't you start and then I'll follow?
Yeah, I mean, look, we're a social issues firm, and we knew that AI was getting big, and the first thing we did was really start to try to figure out how do we pursue AI ethically so that we can find some balance. I'm the first to tell you that we haven't found the balance yet, right? The balance is not in our favor at the moment. But what I think are several things. One is if we are going to use these tools, understanding how much they can benefit populations while also working to make things fair, I think it's honestly a better place than we've been in other technological advances. There is no easy answer. And I think that one of the areas where I've tried to get better is in prompting, because the better you are at prompting, the less resources, the fewer resources you're using. So that's one area I've tried to get better. I look for tools. Like I said, we're getting ready to try out something called Change Agent, because I know that I already know how they're thinking about how things should operate. So I do think that it isn't an easy answer. And a lot of people are saying, I'm not going to do it for now. And that is an absolutely fine way to go. There's a lot of growth still to happen. And I think we just need to be on the side of making sure that people are doing it correctly.
Yeah, and I'll just sort of add that you can't disentangle the good from the bad on AI, right? Like with the good comes the bad. But I guess the way to think about it is with the bad also comes a lot of opportunity. And my husband and I spend a lot of time in West Virginia. There is a data center that they want to build there. West Virginia, if you're in the DC area, there's a historical relationship between West Virginia and the DMV, where West Virginia has sort of been mined, using that word broadly, of its resources to power the urban centers of the DMV, right? So there's a long history of that kind of abuse. Um, and that's just one example. I My way of thinking about this is that we cannot stop this train. We cannot stop this train from happening, right? AI is not going to go away. All we can do is actually be active voices in how we choose to use AI for good and for the work that we do. And then also use your voice in your local communities and with your representatives to advocate for the things that are really important that need to happen alongside of those things. This is very reminiscent of how we did not engage with social media with a lot more at stake, right? Because one, there are bigger energy needs here, and two, this is happening much faster. And we're already seeing that we are being left behind because people are too scared, or they don't want to engage, or they think it's not like going to help, or it's only going to hurt. And I appreciate that way of thinking. But in order to maximize the good and minimize the bad, we have to be active participants. And so that is, I think, hopefully what this webinar and other activities that are happening in our space around this topic are aimed to do, which is to say, let's give some guidance and some understanding and some guardrails to folks so that they can feel safe in this space. But not engaging is not the answer, because it's going to happen, and we're just going to, if we stick our heads in the sand, we're just going to be left further and further behind, and the communities we serve and advocate for are not going to be served in any way, right? There will only be detriment. So I would just say, like, it makes our active participation that much more important.
And kind of touching on that, we had another question around, and Brenda, you kind of talked about this, so I'm going to start with you. You had mentioned some of the tools you were already considering using, but one of the bigger questions is coming around the importance of like what you all recommend for how people engage in this space. So, um, if you could talk a little bit about the tools that you're using and things you might recommend for planning, research, targeted content, audience segmentation that you talked about, um, what does that look like?
So, there's a ton and they change all the time, and how I feel about them changes all the time, right? I mean, I will tell you that it has only been about a month or so that I decided that ChatGPT shouldn't be part of my life anymore. And I won't go into why, but for those of you who follow the news, you probably have a sense of why I decided that. And so to say for every single one of these things, use these things, I think these generative AI tools that you've heard of are helpful. Keep an eye on what they're doing. I will advise you, Axios has a newsletter. It comes out every day. It's Axios AI. Follow that. Every single thing you want to know about what companies are thinking and what they're doing. There's a lot of good stuff there. What I will also say is that I use a combination of tools to try to get what I want. And then finally, the one thing I want to make sure everybody understands, because I know I saw one question about universities and all of that. So the university that I work for is really struggling on AI. I want to give you an example of what I say to my students, because this year, this is their capstone semester. So everybody's doing giant semester-long research products. And I said, look, when you do research now, you are usually doing it online. I might go to the AU online library. I'm going to use all the terms that I can to find my research. The research is going to come up and I'll have maybe 500 after I've done what I need to do. And I'm probably going to pick the top 6 or 7 that immediately meet my needs, right? So once I hit 6 or 7, I'm going to be like, those are my sources. There we go. When you use ChatGPT Scholar or Scholar through Claude or any of those things, guess what it's doing? It's actually finding you the top 7. You will never find the top 7 out of the 500. So those are the kinds of things that you have to learn about your tools and understand that, like for research, that's actually a really good option as long as you're, again, checking the sources and all of those things.
Thank you. And you answered one of the questions around best practices. And I think that's a best practice. So we are getting close to the end of time. So I have one more question for both of you. And it's really, somebody said you guys showed both great examples of how you're using AI to develop health communications products and messaging, and wanted to hear your thoughts on taking it a step further. So are there ways that these tools can function as communications channels? Meeting people where they are and actually driving action like screening and things like that. So if you can comment on that, we'll pull up our final slides while you guys are answering that question.
Go ahead, Amelia.
I'll just note really quickly that in 2024, I published a paper called Where We Introduced the Concept of Health Communication AI. And it really was a foundational piece that looked at how AI could scale health communication really as a messenger. And it builds on the theory and the evidence around opinion leadership and opinion leaders and the role of those opinion leaders in public health programming and the long history of success, and then how opinion leaders have moved and changed in the digital age, and then introduces sort of Gen AI with its ability to communicate in very human-like ways, as sort of the next phase of this like digital opinion leadership idea. That is a really, I think, big opportunity. There's a lot of risk, but there's a lot of opportunity, and there's a lot of things that have to be thought through. That is what we're hoping to sort of build the evidence base around using our VIA chatbot. But I see a long-term vision here for exactly that idea.
Thank you. And thank you both. All right. So real quick to close this all out, I just want to thank Amelia and Brenda again. I know I'll be rewatching it to soak in everything that you guys talked about, and I hope others do the same. This is where I'm going to do a really quick pitch for the society. So I hope you enjoyed today. This is just a taste of what we do here and what membership gets you. And so just want to remind folks that membership is completely free, and it connects you to this community of speakers and people and individuals. And so you'll get access to our newsletters, webinars like this, resources, and other opportunities. So we'll go to the next slide. Just want to also remind folks that the annual summit is coming up August 11th and 12th in Boston. So be on the lookout for registration for that. Again, you can sign up for free membership at the Society's website, or you can follow us on LinkedIn to stay connected between events. I just want to make a plug that we're always looking for suggestions for future webinar topics and speakers. So if today sparked any ideas for you, we want to hear from you. Please reach out to us. The email address is on the slide. You can share with the Society forum what's going to come at the end. But either way, just take a moment to share your thoughts. And thank you again to our speakers and for everybody who could join us today. So we'll see you next time.